Episiotomy, to cut or not to cut. So what is an episiotomy? Sometimes, just as the baby is about to be delivered, the doctor will take a scissors and cut the bottom part of your vagina to make more room for the baby to come out. That's called an episiotomy. Episiotomies used to be very common, and in some cases were cut on everybody. That's sort of fallen out of favor now, and most people aren't cutting episiotomies as often, and some of us don't cut episiotomies at all. I'm personally in the no episiotomy camp. I really never cut episiotomies. In fact, the last time I cut an episiotomy was probably 4 or 5 years ago because some lady was screaming and cussing at me to cut the episiotomy, which I really didn't want to do, but ultimately did what she wanted. The funny part was, while I was repairing the episiotomy and sewing her up, she got mad at me for cutting her. Then her husband actually got mad at her because she yelled at me. But that's a whole other story. Anyway, if you don't have an episiotomy, then you might have what's called a tear, which is where the vagina will tear on its own to make the room that's needed for the baby. And so some people feel that cutting an episiotomy makes a cleaner tear and it repairs better than if you tear naturally. I personally don't feel that way. In my hands at least, most of the time people don't tear at all. And when they do, it's really almost always much less than what would have happened if I would have cut with the scissors rather than let things tear. And let me kind of give you an example. Those of you who have ever done any sewing or anything, if you take a piece of fabric and you try to tear it, it's very hard to do. If you make a little snip in it, we all know then if you tear it, it just falls apart. And that's the way I see when we cut episiotomies. A lot of times you'll cut a small episiotomy, but because you've done that, you've lost the integrity of the skin, and so when the head comes through, it'll tear it and you'll have a much, much larger tear. And so I don't personally believe in episiotomies. Also, there have been patients, and it's not uncommon, where I look and it's like, boy, this is going to be a bad tear, and I'm thinking, man, I'm going to be sitting here sewing this up forever. And then by being very careful and slow and meticulous, I'm able to get the baby out, and I look down and there's no tear at all. And I'm very thankful in that case I didn't cut an episiotomy, because that way you don't need any stitches. If you tear or if you get an episiotomy, then we put stitches in to repair it, and we put it back to where it was when we started. The stitches that we use are dissolvable, so you don't have to worry about coming in to have the stitches removed. It takes about 6 weeks before everything's back to its natural strength, which is why we always tell people not to have sex in the first 6 weeks after delivery, because it can open up that tear otherwise and make everything worse. At the end of the 6 weeks, it doesn't mean everything's back to normal and feels comfortable, but it's strong enough where we don't have to worry about it. It can take longer before things really are back to normal. So that's the controversy of episiotomy versus tearing or versus no episiotomy. And I think it's something that you certainly want to talk to the delivering physician about and see their take on it, and have them explain how they like to do it. First babies, that's where you're most likely to get an episiotomy. If you've already had a baby before, there's usually much less of a reason to do that. But again, many of us don't cut episiotomies at all. So something to think about.